Welcome back, guys. I'm Moses. Subscribe to my YouTube channel, like, share, and comment to get more of my health videos. Now, today I'm gonna talk more of anal itchiness. I will focus myself on the causes of the anal itchiness and what are the prevention of the anal itchiness. Now, the anal itchiness, or what we call pruritus ani, this is an irritation, in the perianal region that cause a desire of scratching yourself in the anus. So it's just an irritation. It's very more common condition in just male than female, and at the age of 40 to 60, however, it can affect each and everybody. Now, what are the causes of this pruritus ani, or what we call the anal itchiness? Now, number one cause is what we call the hemorrhoid. Hemorrhoid, these are the swollen veins, in the what we call the rectum or the anus. They can be either external or internal engorgement of the veins. They cause much just pain, itchiness, and even a burning sensation during even defecation. This is one of the cause. This engorgement of these veins, this generally we call them the hemorrhoids. They cause the anal itchiness. Now, the other thing is what we call the anal fissure. This anal fissure is what we call the tiny cuts, in the rectum or in the anus. This happens mostly when you have constipation, yeah, or when you have the long-term diarrhea. It's gonna cause much pain also and the itchiness in the anal region. Now, the other cause is what we call irritants. Now, this is more of dietary causes, like certain foods, like what we call the spice foods, tomatoes, and what we call even coffee. They cause just irritation, in the skin during the bowel movement. This gives you also an itchy. You feel like scratching yourself in the anus. So this is another cause. These irritations, these irritant kind of foods. The other thing is what we call the anal fistula. Anal fistula, or the fistula in anal. Now this is what we call the tunnels, that develops in the bowel and near the skin of the anus. This causes also pain during defecation, and you feel like itchy. If you have these vistas, you feel like yourself like itching and the discomfort in the anal region. Now, the other cause is what we call the medication. This medication we take, normally we treat ourselves, maybe blood infections and other bacterial infections in our body. So the medication we take, like if we say the antibiotics, sometimes they can kill what we call the normal floras in the gut and even in the anal area. This causes the anal discomfort. It requires you to have some probiotic and other supplements so that you can get relieved of this irritation. So this is also another cause. Some other medication can cause or kill the normal floras in the body. Now, the other cause is what we call the infection. This infection, it can just range from what we call the bacterial infection to fungal infection, and even to viral and sexual transmitted infection and other parasitic infection. Like, for example, we can say about the sexual transmitted infection, such as what we call the warts. This, they cause some cramps in the anal area and even pain and even bleeding during the vacation. So they need to be treated. You need to go for a checkup, for an examination by the doctor, so that you get the right treatment, because if left untreated, they're going to cause much complications. Now, the other thing is what we call the parasitic infection, such as the pinworms. If the female worms lay just eggs around the anus, they're going to cause irritation, you feel itchy so around the anus. So they need to be treated. You need to get treatment toward these worms. The other thing is scabies, which is a parasitic infection. I discussed it in my the other video, so subscribe to get it. So this scabies is what we call the human mite, which is very itchy. So if it just burrows in the anus, you feel itchiness during mostly at night. You feel itchy. So this one also one of the parasitic infections that are gonna cause the anal itchiness. Now the other thing is what we call the fungal infections such as the Candida albicans, bacterial infections such as the Staphylococcus infections. This is gonna cause also the anal itchiness. The other thing is what we call the diabetes. If there is high blood sugar in the body, now it's gonna damage the nerve fibers, and now if there is damage the nerve, the only thing is that there is also high cytokines secretion in blood. Remember, cytokines is one of the inflammatory agents, so it's gonna cause inflammation and the itchiness also in the body and even the hand. So mostly type 2 diabetes. Now, these all causes, they require you to go for the when you feel like you have a very severe pain and itchiness in the hand area, you need to go for a checkup so that you can get the right just examination, investigation, and even treatment. So when you feel like you have very severe or severe what we call pain and persistent, you need to go for a checkup. Now the other thing is prevention. How we gonna prevent this this anal itchiness, or what we call the pruritus hernia. Now one is what we call the you need to just avoid what we call the irritants, like this spicy food and or other stuffs that could cause the irritation and the addiction. The other thing is what we call you need to wear what we call the cotton, this white cotton underwears than wearing the tight dry underwears. These are good for the moisture also that can cause the dry ones can cause, and tight causes the warmth, which is not the good environment for the anal region. Now the other thing is you need to eat vegetables and the whole grains. Is also good for the anus and the other body formation. Now the other thing is that you need to observe the anal hygiene, cleanness, gently, so that you can not irritate yourself in the anal opening or sphincter. The other thing is what we call your fluid, these emerge chemicals that can cause irritations in the body. By so doing, and this you just get well, you not get this more of the anal itchiness or the pruritus hernia. Now, you need to go to the doctor if you feel like you have some anal itchiness, some pain, and also other discomfort, and it's very severe, very persistent. You need to go for examination and also investigations so that you can get the right treatment. Now, keep subscribing, like, share, and comment to get more of my health videos.